Hello and welcome to our channel. In today's video we will discuss about fatty liver disease or hepatic steatosis. In this video the topic which we will cover are what is the anatomical location of the liver. After that we will discuss what exactly you understand by the term fatty liver. What is fatty liver disease? Then we will discuss about the pathogenesis of fatty liver, and after that we will discuss about the various types of fatty liver disease, and after that we will discuss about the risk factors. Then we will discuss about the etiology, that what are the causes of fatty liver, and after etiology we will discuss what are the 4 stages of fatty liver disease, and after that we will discuss about the clinical feature, that is what are the signs and symptoms of fatty liver disease. And after signs and symptoms we will discuss about the investigations and diagnosis of fatty liver disease. And after that we will discuss a very important part, that is the management part and treatment and prevention also, that how one can manage fatty liver disease. And at last we will recommend diet for fatty liver disease. So we will also discuss about the diet for that, what is the accurate diet for fatty liver disease. So these are the topics which we will cover in this video. So let's start our today's video, that is fatty liver disease, or you can say hepatic steatosis. So first of all we will discuss about the anatomical location of the liver, that where is liver located in the body. So first of all we will discuss about it. So as we all know that liver is a peritoneal organ which is positioned in the right upper quadrant of the abdomen, and it is the largest visceral structure in the abdominal cavity and the largest gland in the human body. This largest gland of the body, which is called liver, it performs many functions and a wide range of. What is the anatomical position here, or you can say anatomical location? So liver is predominantly located in the right hypochondrium and epigastric areas, and little bit part of it extends into the left hypochondrium. So this is the exact anatomical location of the liver in the human body in the abdomen. So this was all about the anatomical location. Now next we have what do you understand by the term fatty liver, that what exactly is fatty liver. So now we will discuss about this. So steatosis. Alright, so it happens when fat builds up in the liver, and having small amounts of fat in your liver is normal, but too much can become a health problem. So this is called fatty liver, and fat in your liver can cause liver inflammation, which can damage your liver and create scarring. In severe cases, this scar can lead to liver failure. So, when fatty liver develops in someone who drinks a lot of alcohol, it is known as alcoholic fatty liver diseases. And when in someone who doesn't drink a lot of alcohol, then it is known as non-alcoholic fatty liver disease. So I hope it's very clear to you that what is fatty liver. What happens in a normal liver that it becomes fatty, and it creates many problems in digestion, in the function of the pathogenesis of fatty liver. So let's talk about it. So as we all know that lipids are present as the free fatty acids which enters the liver cells from either of diet or from adipose tissues. So whenever we consume that in our body, either from adipose tissues or from diet, then we get free fatty acids. And these free fatty acids get converted into fatty acid, and they release cholesterol esters, phospholipids, and ketone bodies. And after that, with the help of alpha glycerophosphate, these fatty acids get converted into triglycerides. And when they become triglycerides, so the lipids accept the proteins, and then the triglycerides get converted into lipoprotein. And when the lipoproteins are released into plasma, then they become plasma lipoprotein. Now next, what are the various types of fatty liver disease? So as you can see here on the screen, there are mainly two types of fatty liver disease, that is non-alcoholic fatty liver disease and alcoholic fatty liver disease. And first of all, we will talk about non-alcoholic fatty liver disease. So you can see here, non-alcoholic fatty liver is again divided into two subtypes, that is Steatohepatitis. So let's talk about first type of fatty liver disease, that is non-alcoholic. So the first subtype of non-alcoholic is non-alcoholic fatty liver disease. So what are non-alcoholic fatty liver disease? Basically NAFLD. So non-alcoholic fatty liver diseases occur when fat builds up in the liver of a people who don't drink a lot of alcohol. And if you have excess fat in your liver and no history of heavy alcohol use, then you may consult and may diagnose you with NAFLD. And if there is no inflammation or other complications along with the buildup of fats, the condition is known as simple non-alcoholic fatty liver disease. Now the second subtype of non-alcoholic fatty liver disease is non-alcoholic steatohepatitis, NASH. So let's talk about it. So non-alcoholic steatohepatitis is a type of NAFLD, that is non-alcoholic fatty liver disease. It occurs when a buildup of excess fat in the liver is accompanied by liver inflammation. If you have excess fat in your liver and your liver is inflamed and you have no history of heavy alcohol use, your doctor may diagnose you with NASH, that is non-alcoholic steatohepatitis. And when left untreated, NASH, that is non-alcoholic steatohepatitis, can cause scarring of your liver, and in severe cases it can lead to cirrhosis of the liver, which is an advanced pathology of liver after fatty liver, and even it may lead to liver failure. So these are the subtypes of non-alcoholic fatty liver disease. Now next we will discuss about the second type of fatty liver disease, that is alcoholic fatty liver disease. So the first subtype of alcoholic fatty liver disease is alcoholic fatty liver disease, that is ALFT. So let's talk about it, that what do you understand by the term alcoholic fatty liver disease? So drinking a lot of alcohol damages the liver, and when it's damaged, the liver cannot break down fat properly, and this can cause fat to build up, which is known as alcoholic fatty liver. An alcoholic fatty liver disease is the earliest sign of alcohol-related liver diseases. If there is no inflammation and other complications along with the buildup of fat, the condition is simply known as alcoholic fatty liver disease. Now next subtype of alcoholic disease, that is alcoholic steatohepatitis, that is ASH. Now let's talk about it. So alcoholic steatohepatitis is a type of ALFT, that is alcoholic fatty liver disease, and it happens when a build-up of excess fat in the liver is accompanied by liver inflammation, and this is also known as alcoholic hepatitis. If you have excess of your fat in your liver and your liver is inflamed and you drink a lot of alcohol, your doctor may diagnose you with ASH, that is alcoholic steatohepatitis. Stato simply means fat. Excessive accumulation of fat in your liver, that is called steatohepatitis alcoholic. And if it's not treated properly, then alcoholic steatohepatitis can cause scarring of your liver, and severe liver scarring is also known as, which we know better, that is cirrhosis of liver, and cirrhosis of liver even can lead to liver failure. So it's a very emergency condition. So this was all about the various types of fatty liver disease. I hope these are very much clear to you guys. Now next, what are the risk factors now? What are the risk factors of fatty liver disease? So we will discuss about them one by one. So drinking high amount of alcohol put you at increased risk of developing fatty liver. And you may also be highlighted risk if you are obese. So risk factor here are obesity, have insulin resistance, if you have diabetes type 2, diabetes mellitus type 2, and if you have polycystic ovary syndrome, if you are pregnant, if you Traxol, and if you have metabolic syndrome. So these are the risk factors for fatty liver diseases. Now next, what is the etiology? That what are the causes of fatty liver disease? So let's talk about it. So fatty liver develops when your body produces too much fat or doesn't metabolize fat efficiently enough. The excess fat is stored in the liver cells where it accumulates and causes fatty liver diseases. This buildup of fat can be caused by a variety of things. For example, drinking too much alcohol can cause alcoholic fatty liver disease, and this is the first stage of alcohol-related liver diseases. In people who don't drink a lot of alcohol, the cause of fatty liver disease is very less clear. And one or more of the following factors may play a key role here, that is the basic etiology, that is obesity, second high blood pressure, third insulin resistance, for high level of fat, especially triglycerides in your body, in your blood. The least common etiologies or the causes include pregnancy, rapid weight loss, some type of infections like hepatitis C, certain type of medications, and exposed to certain toxins. So this was all about the etiology or the causes of fatty liver disease. Now next we will discuss about what are the stages of fatty liver. So fatty liver can progress through 4 stages. First stage, that is simple fatty liver, which means there is a buildup of excess fat in the liver. Then it leads to steatohepatitis. Now, what do you mean by steatohepatitis? So in addition to excess fat, there is inflammation in the liver. Then it leads to third stage, that is fibrosis. Fibrosis means inflammation in the liver and has caused scarring. And whenever the scarring and the inflammation plus excess of the fat occurs in the liver, then it leads to cirrhosis of the liver, which is advanced pathology and a very dangerous disease. So cirrhosis means scarring of the liver and has become widespread. So cirrhosis is a potentially life-threatening condition that can cause liver failure. It may be irreversible, That's why it is so important to prevent it from developing in the first place. So these